better not opt out. You better not opt out. Because understand something. The game is going to be, okay, let's support the public option, and then we'll get Arkansas to opt out. And so Arkansans will not be covered.
Right.
So please, don't get fooled.
On the opt-out that is being proposed by the U.S. Senate, in order for a state to opt out, the state actually has to have its own insurance requirements that meet whatever the federal wants it to be. So the federal is going to control whether or not a state is going to be able to opt out. Okay? And all right. So basically, the state has to meet certain requirements for its own health care system in order for that state to actually opt out. Again, that was in the Senate Finance Committee bill, or whatever they put together. All right. Now, here is on the House health care bill. It's actually been proposed. At first, individuals and employers with 25 would be eligible for the government-run plan. Then in year 2, individuals and employers with 50 or employees or fewer become eligible. So this public option here is only going to start out at a low thing, and then it's going to gradually take over. So what's going to happen is a business, in order to save money, what they'll end up doing is they'll end up dropping their employee-based health care coverage so that the only option that you have is the government-run health care. So it will actually, I believe, in the long term and in the long haul, it will actually take away the choices that we really want by doing the public option. Of course, I said earlier, I believe that you can do other things, to reform health care without doing the public option.
The Senate bill, which combines the Finance bill and the Health, Education, Labor, and Committee bills, that is actually being scored right now by the Congressional Budget Office. There's nothing in print for anyone to read. So what he just said, it's not true. No one has read that. That doesn't say. I mean, I know Newsmax and the Heritage Foundation might think otherwise, but that's not true. There is no bill for anyone to read right now because they're figuring out how much it costs before they send it to the Senate floor. Again, untrue. That's the Finance bill is not the final bill.
We're going to get about 30 seconds.
Okay, did you hear what he just said? And remember, I'm not a Democrat or Republican. I want what's right, and I just want what's right. But he said there's no bill. So what are we talking about?
There's no bill.
I'm just saying that what's misrepresented and what you're wrong and this or that. The common sense, we even admit it. There's no bill. We're talking about the dream of what we want. But there isn't even a bill to talk about. And yet we're trying to come up with pieces, and it's changing day by day. Who heard of an opt-out program 3 weeks ago? We didn't even know what it was. And now it's something new. What's tomorrow?
I just want to respond to the question. As a healthcare provider, at the end of the day, what needs to come from healthcare reform is increased access. Increased access for people who don't have it. Poor and people of color are the people that I represent. Okay? How you do that, I believe public options, the words now are a dirty word, and people use that to incite, get everybody upset. But I do believe that there's going to have to be government support for however you want to term it, because I think it's an investment that we should make. I don't know how you want to do it. You want to expand Medicaid? I don't know. Public option, but we have to have that as a priority in our system. I also think that we're all in this room, we are Americans. So it shouldn't matter where you live, what state you live in, whether you live or die, or have access to health care.
Yes. And here's what we're going to take. Starting with Ms. Burlsworth to come across, we'll give you 1 minute, and this time I'll call you over time. Real quick, I hope you don't want to completely out. I'll give you 1 minute to give the 1 minute comment and wrap up or address any issue you wish to relative to health care.
That was my intention, because it surely wasn't. And, I just wanted to extend my hand and work with one another. That's what we need to do instead of work along divided lines. Honestly, we need to come together, I think. And I did want to bring up one final thing that concerned me, and I'd be glad to send it to you. It was done in 2007 from the Florida Hospital Association, and they estimated, and I'd be glad to send this to you, they estimated that $100 million was spent on illegal patient care, and it was ongoing care. Now, let me say this. hospitals are going broke all over our nation. And so I just want to say, we need to watch this. I mean, there's things that we can't just take care of everyone. And what had happened is, that in this ongoing care, they had been in the hospital a couple of years, and his fee was like $1.5 million, and they spent $30,000 taking him home because they couldn't afford to care for him anymore. So that is a concern in our health care.
Don't want to scare you, but that's up here.
Reform is a major change to correct a major problem. We do have a major problem. Our present health system is broken. And we, the people, through participatory democracy, which we are practicing now, you don't have to be a Wendell Griffen, you don't have to be Mr. McCullough down there, but you do have the right to decide on who will cast your vote on a health care crisis. Those two people in the Senate, you know who they are, and you know who's in the House.
Thank you.
I just want to thank you all for having me here today. I enjoyed being here and being on the entire time, but I encourage you all to get involved. I want to echo several statements. Please contact your representative and your two senators and urge them to support real health care reform this year. There are too many Arkansans without insurance, and there will be too many more if we let the status quo stay as it is. I encourage you to check out BarackObama.com. You can find out ways to get involved with our health care reform campaign. Call on other Arkansans to get involved too. So again, thank you for having me.
I would also like to thank you all for having me today. And again, I think the thing is that we all want health care reform, but it is how are we going to do it? Are we going to depend upon the government to do it for us, or are we the people going to actually band together and do it? I believe that we the people can get together and do it much more effectively and much more efficiently. We talk about compassion. Well, I believe that we are compassionate people, and I believe that if we get together, if we band together, we can fight the government, we can fight the insurance companies, and we can make our healthcare system better. But I believe that a government takeover of it will just leave us hanging, and I don't think that that's the right way to go. I think, again, we need to band together as we the people, as churches, as communities, and fix our healthcare system.
Thank you.
I would like to thank Attorney McCullough for doing such a wonderful job of moderating. And I would like to thank Dr. Darrough for putting together this panel. I'd like to thank Pastor Gibbons for allowing us to be here and hosting more of our houses of worship should be using. This tax-free property that's open should be open 24/7 for this kind of purpose. Let me use the rest of my time to say this. My friends, Ms. Abrams is right. Senator Lincoln, Senator Pryor, and Representative Congressman Snyder need to hear from us. They need to hear from us, and we need to tell them, we need to call them every day and say, I want you to support health care insurance reform with a strong public option. That needs to be the only thing they need to hear from us until they come home. And if they don't pass it, then the next time they go back, they need to start over again. Please, this is the chance to make a lifetime difference.
Thank you.
I'd like to echo everybody's statements and thank you all very much for having me. I really appreciate the opportunity to speak with you all. I'd also like to thank our hosts. It's been absolutely wonderful and you've been very gracious. I'd like to echo the judge's statements and say that public health insurance option is the only path towards real reform. We are closer than we have ever been to getting real health insurance reform in this country. And we need to be calling Senator Lincoln, Senator Pryor, Vic Snyder. We need to call them all. We need to call them every day. I want you to get a hold of them every single day until this thing's done, because we may not ever be this close again. So once again, thank you very much.
Thank you.